To turn to our coverage of the Covid-19 pandemic now and speak to a South African doctor currently based in the UK. That's Dr. Sangxa Rozani, a Manchester-based medical doctor in the United Kingdom, who says no vaccine has or can claim to be 100% preventive. He's also said that vaccines can, however, protect people from serious illness and possible death. That is the general consensus, of course, in the medical and science field. So what then is the point of taking vaccines? Some of you have been asking. Let's speak to Dr. Rozani himself, who's joining us tonight from Manchester. Doctor, grateful for your time. Welcome to the program. I suppose we can't speak to a South African in the UK tonight without asking if you've been personally impacted by the travel ban.
Good evening, Tembagila. Thank you for having me, and good evening to your viewers. The travel ban impacted us as a family in December 2020 because that is when we were going to come back home. We had to scrap those plans around March because we could see that something was happening. So it was a decision that was taken well in advance. And the reason now this one is not that much important is that we were never planning to travel imminently because we are still in a pandemic. The travel restrictions, even though they get lifted and they get dropped, but we need to be able to change our behavior as human beings. We can't be operating as if it's 2019. So individually, you need to be able to say, during the pandemic, this is what I have changed.
And you talk about the early stages of the pandemic. The UK was one of the parts of the world that really bore the worst of the brunt in 2020 and in early 2021 as well. There were some worrying scenes there. Hospitals overrun with sick patients, people dying far from their families. When you consider the scenes that you witnessed along with your colleagues and you look at the hesitancy among some South Africans and full-blown anti-vax sentiment in other parts, it must be said, how do you make sense of that? Doctor, I think we have you back. We had lost you for a moment. I was asking you about, for your opinion on the hesitancy that still remains in South African society as far as being vaccinated, especially as someone who worked in the UK when the country was dealing with the worst of its outbreak. I think Dr. Rozani is muted. Let's see if we can resolve that. Doc, if you can hear me, if you could just unmute yourself. Yes.
No problem. I think at the height of the pandemic, when you were dealing with, we had said from here, we were 3 months ahead. So we did try to sound the alarm to start moving. But unfortunately, it got to happen late because from the UK, we were 3 months ahead. We were able to predict what was going to happen in South Africa before it did. But unfortunately, it took a bit longer for South Africa to act. And that has been the same situation that has happened with vaccination as well. We started the rollout in the UK in December. There have been noises trying to get South Africa to get the rollout going, but the rollout started mid-May. I'm deliberately not talking about the study that was done before that. The rollout for the population started in mid-May. Now, we are at an opportune situation now. In fact, we were before the new variant because when we vaccinated as South Africa initially, we were vaccinating during the peak of the pandemic, which is not ideal, but it had to be done because we needed to protect as many people. Now we are sitting as South Africa at 34.8%. We've got a new variant, but it's still difficult to get people off the starting blocks. So we are now late because we are now supposed to be doing boosters because the evidence is there, the data is clear. Two vaccine doses of the schedule of the Pfizer, Moderna, and the 1 dose of Johnson & Johnson. There is a documented waning of immunity.
And it's interesting. Pardon me, it's interesting that you reference the mixing, right, of the two vaccines for boosters, because in South Africa, at the moment, there isn't talk for the general population as far as boosters. It's to do with healthcare professionals, and still government is talking about giving them a second J&J shot instead of the mixing of two vaccines. What do you make of that?
Now, I have been quite vocal about that because there has been studies that have been done which show what vaccine, the immunity that you get after you've mixed a J&J with a Moderna, which is the highest, or you've mixed a J&J with a Pfizer, and you've added a J&J. And there have been very impressive results on mixing the other vaccines with the mRNA, which is the Moderna and the Pfizer. Now, what is happening with our healthcare workers is, you will say healthcare workers are being given this booster and they are in a study. But in the numbers, if you look at the EVDS in September, look at the number of healthcare workers that have been vaccinated and the number of healthcare workers we were told needed to be vaccinated. And the percentage you will see there is startling. Because even though we talk about uptake for the general population, we need to take a closer look at the uptake for the healthcare workers. And what has happened in this booster study that is being undertaken, we don't know how much waning the healthcare professionals that got this J&J dose in February or March, because we are now plus 8 months that they got it. But it is still called a study, but we don't have those results. But if you look at the studies that were done in America and in the Netherlands, you can see that they are showing the increase in the antibodies after you've mixed the mRNA with the J&J. And I'd just like to add, in the UK, AstraZeneca was rolled out extensively. The booster shot for the UK is Pfizer, irrespective of which vaccine you got. So the UK is not doing a study on mixing. It is actually boosting people. The regulators in South Africa will grant a license for the mixing. It's just that it will be late at the time. The regulators in South Africa will grant a license for booster doses, but it will be late. We are always moving late.
And what do you make of that specifically? Because let's be clear, even when the first batch of the vaccines, the AstraZeneca ones, were acquired, there'd been quite a period where there seemed to be uncertainty about whether we'd get them in time or not. And then we got them, and then there was the hurdle to do with how the efficacy of that vaccine at the time. And then eventually we moved on, but there just always seems to be a delay in the process.
Now, I was joking earlier on, but we seem to be... Sorry. Yes.
I'm not sure what's going on, but I think we've got a second person on this call. Doctor, if you can still hear me, let's continue with your thought. Okay, I think we've lost both Dr. Rozani and the third person who we saw appearing on our screens there. Guys, can you confirm? The doctor is back.
My device crashed, so I had to use another one. Sorry.
Oh, not a problem. I think this has quite an eventful link. Let's pick up with your thoughts.
No, I was saying we as a nation are now blessers in the vaccine space, because we blessed other countries with our AstraZeneca, and yet some of our professors in vaccinology were very vocal. Use the AstraZeneca for the older generation. It will prevent hospitalization, severe disease, and death. But the government and the health department did not listen. The doses went. Now we're hearing in the last week that we've got a surplus. We're going to stop our imports. But you've got 34.8% of the population that have already vaccinated. They started in May, so 6 months is ending now. This is the time for boosters to start. The new variant, we don't know exactly what this 32 spike protein is going to do to the vaccines. So obviously, if you've got a 2-dose regime and a 1-dose regime, you need another dose, which is called a booster. I don't want this language of saying it's not a booster, it's a second or it's a third. It is a booster. Let's call it what it is.
And should it be for the elderly and people with comorbidities, or to everyone who wants to vaccinate? Because South Africa is still sitting now with a situation where only about 30% of people have actually lined up to get vaccinated.
That's another mistake the South African government made. They started with the age cohorts, and yet the rest of the world were doing age and comorbidities. Because we were saying at the beginning, people with comorbidities are more at risk. But now when South Africa starts the rollout, they just go with age and they leave out people with comorbidities. which was wrong. They are repeating the same mistake again with the boosters. You need to be able to boost the older generation, the people with comorbidities. And I remember, I was following this very closely. I remember we were being told we can't trace them, or people are going to register and we won't know whether they've got comorbidities or not. But how can the health department not know who's got what when they are the health department? They've got chronic clinics around the country. People go for repeat meds every month. Why is that data not collated?
A good point to leave it then with that question. Dr. Sangxa Rozani speaking to us from Manchester in the United Kingdom. Thank you for your time, sir.
Okay, thank you.